everyone, welcome to Edumindz. My name is Shalini, and today in this video we shall look at the anatomy of olfactory nerve, about its structure, anatomical course, diagrams, and its clinical relevance. So let's get started for today's topic. The olfactory nerve is the first and the shortest cranial nerve which transmit information relating to smell. Embryologically, the olfactory nerve is derived from the olfactory placoid, which also give rise to the glial cells which support the olfactory nerve. Function of olfactory nerve is transmission of spatial sensory information from the nasal epithelium to primary olfactory cortex, which is located in the brain. Olfactory nerve is a kind of spatial visceral afferent nerve. Anatomical course of olfactory nerve describe the transmission of spatial sensory information from the nasal epithelium to the primary olfactory cortex of the brain. The sense of smell is detected by the olfactory receptors, which are located within the nasal epithelium. Their axons assemble into a small bundle of true olfactory nerves, which penetrate the small foramina in the cribriform plate of the ethmoid bone, and then it enters the cranial cavity. Once in the cranial cavity, the fibers enter the olfactory bulb, which lie in the olfactory groove within the anterior cranial fossa. Olfactory bulb consists of mitral and tuft cells, which give off some fibers that further form the olfactory tract, which reaches the primary olfactory area. These are located in the primary olfactory cortex, and this primary olfactory cortex include the anterior perforated substance, periamygdaloid bodies, and the piriform areas. Fibers which are arising in the primary olfactory cortex now go to the secondary olfactory cortex, which is also known as the entorhinal area, and this secondary olfactory cortex is located in the uncus and the anterior part of parahippocampal gyrus. Smell is perceived in both the primary and secondary olfactory area. The olfactory afferent pathway consists of only two neurons, and the fibers reaches the cerebral cortex without synapsing in any of the thalamic nuclei. Now let's come over the diagram. So in this diagram, you can clearly see the olfactory mucosa, which is located in the roof of the nasal cavity and is composed of the pseudostratified columnar epithelium, which contain number of cells. These cells are basal cells, sustentacular cells, and olfactory receptor cells. Olfactory receptor cells are bipolar neuron, which consist of two processes, the dendritic process and central process, which is also known as axon. Dendritic process project to the surface of epithelium, where they project a number of short cilia, the olfactory hairs, into the mucous membrane. These cilia react to the odor in the air and stimulate the olfactory cells. Central process are also known as the axon of the olfactory nerve. They passes through the cribriform plate of the ethmoid bone and then enters into the cranial cavity. Through the olfactory tract, they reaches to the primary olfactory area and to the secondary olfactory area. Smell is perceived by both primary and secondary olfactory areas. Now let's talk about the clinical condition related to the olfactory nerve. So here is a case of anosmia, which is a condition in which there is no sense of smell. It can be temporary, permanent, progressive, or congenital. Temporary anosmia can be caused by any infection, like in case of meningitis, or by some other local disorder of nose, like in case of common cold. And permanent anosmia can be caused by any head injury or tumor which occur in the olfactory groove. For example, the case of meningioma, there will be the permanent anosmia. And anosmia can also occur as a result of some neurodegenerative conditions, like in case of Parkinson disease or in Alzheimer disease. In this condition, the anosmia is progressive and precedes motor symptoms, but is not often noticed by the patients. Anosmia is also a feature of number of genetic conditions such as in Kallmann syndrome, where which is failure to start or finish puberty, and primary ciliary dyskinesia, which is characterized by defect in cilia which cause it to immobile.